Today we're talking about one of the most painful conditions known to humanity, trigeminal neuralgia. The pain is so intense, so unrelenting, that it's earned the tragic nickname, the suicide disease. And that name alone tells you just how devastating this condition really is. To even begin to understand it, you have to start with the pain itself. The most common way people describe it is like a sudden, violent electric shock to the face. But honestly, even a phrase that powerful doesn't quite do justice to the sheer ferocity of what patients feel. So that really brings us to a big question, doesn't it? When you try to imagine the absolute worst physical pain a person can go through, what comes to mind? Well, for a huge number of doctors and patients, the answer, without a doubt, is trigeminal neuralgia. Okay, so let's dive right in. In this first part, an unbearable electric shock, we're going to break down what this condition actually is and, what's going on that causes this kind of feeling. So trigeminal neuralgia, or TN for short, is a chronic pain condition. It all centers on the trigeminal nerve, which is kind of like the main data cable for all the feelings from your face to your brain. And one of the real hallmarks of TN is that it almost always hits just one side of the face. It's very, very rare for the pain to cross over to the other side. And one of the cruelest things about this disease is its pattern. The attacks themselves are incredibly fast. We're talking seconds, maybe a couple of minutes at most, but they are just agonizing. They can happen over and over, sometimes hundreds of times in a single day, and then they can just disappear for months, even years. This leaves people in this constant state of dread, just never knowing when it's going to come back. So who does this usually happen to? Well, TN can technically show up at any age, but it's much, much more common as people get older. The data here tells a really clear story. It overwhelmingly affects people over 50, and a huge 70% of cases actually start after someone turns 60. But the pain, as bad as it is really only part of the story. The truly life-shattering part of TN, and what we're going to look at now, is what sets it off. It turns the most normal, everyday moments into sources of pure fear. And this is the real tragedy of it all. The triggers aren't some rare, avoidable thing. They're the basic fabric of being a person, smiling, talking, brushing your teeth. Even something as simple as a cool breeze on your cheek can set off that electric shock. Just imagine that for a second. Living in fear of the very things that connect us to the world and to each other. And it's not hard to see where this leads, right? When you're scared to eat, to talk, or even to feel the air on your skin.